Will Fluidda be able to help people with COVID-19?
We sure hope so. Maybe just a brief summary of what this virus actually does. So the virus binds in the lungs to the receptors. And then the body tries to fight the virus by creating an inflammatory response. Now, in a small percentage of the population, the body overreacts and the lung is flooded with these inflammatory cells in a liquid. So of course, if the alveoli fill up with liquid, the gas exchange is impaired. And that's where the patients become critically ill. They have to be on a ventilator for a long period of time. They end up in the ICU. And if too many patients end up in the ICU at once, the whole system tends to break down. So what FRI can do is in the early stages detect how much is this lung already compensating for this disease and predict whether this patient will stay stable or whether this patient is at risk of ending up eventually in the ICU. There are a lot of disturbing reports coming our way saying that even for young people with coronavirus, they're sick for about a week, then they recover, and all of a sudden they rapidly decline with a lot of oxygen desaturation ending up in the ICU. Now we're convinced that this disease process is already noticeable in that initial stage. So if we can detect it there, we can start treating these patients earlier and hopefully prevent the more severe ICU uptake and the more severe need for intensive care.